when
Yes.
a female patient comes back having failed isotretinoin because she relapsed, I start spironolactone about 2 months before stopping the isotretinoin to try to keep the sebum reduction going. And I'm quite successful in that regard, but she didn't want to be on spironolactone.
I
So,
actually learned that Accutane hack from you in one of our previous discussions. I
oh,
love
did you?
doing that now as well, and
Yeah,
it's so effective. But I
it
can
is.
understand her, her nervousness at this point. This is a tricky case.
Yep. So what would you do?
So, given the fact that we can't use or not that we can't, but she doesn't want to go with oral spironolactone, toward the end of her course, I would certainly restart her on isotretinoin, because as we've discussed, there is no law that you can only give one course of isotretinoin or two courses of isotretinoin over a person's lifetime. So, I would certainly consider putting her on a third, considering how much scarring and PIH it looks like she's accumulating. But I would certainly, start low, go slow with it. She, of course, should also potentially be on something that can maybe block some of those androgens that are bringing back this acne with such force at 3 months post isotretinoin.
And that is exactly what I did. We started the isotretinoin again, because to your point, 5 courses, 6 courses, whatever the heck it takes. Sometimes I change things up a little bit and I go to low dose long term for that third course. Succeeded. I honestly didn't know where it was going to end up. I wasn't sure that clascoterone was going to give me the same bang for my buck as spironolactone orally did. But 3 months later, she's still clear and my fingers are crossed because she never made it to 3 months before.